Byron, thank you. This morning we're talking about something so important, how Erie County is working to protect your family, making sure you're prepared in case anyone you might know overdoses on opioids.
It comes as the number of opioid deaths jumped during the pandemic. Take a look at this chart. You can actually see from 2019 to 2020, the number of opioid-related deaths in Erie County went up by 90. As of November, the county had confirmed 141 deaths. That number's gone up even higher now to 165. All new for you this morning, 7 Eyewitness News reporter Taylor Epps showing us how Erie County is working to turn this trend around. Taylor.
Hey, Ed and Katie. Well, Western New York has been fighting the opioid epidemic for years, and the COVID-19 pandemic has only made that fight harder. Now that we're here at the end of the year, we're taking an in-depth look at where we are now compared to 2020 and what Erie County is doing to change things come 2022.
This is heartbreaking what we're seeing out here today. We're seeing so many people that we're losing.
100,000 people nationwide, 91 in Niagara County, more than 100 confirmed in Erie County with 100 more pending cases. People losing their lives to opiates and addiction.
This is a chronic disease, not much different than something like diabetes.
But who are these people?
The person that we're losing is much older. Our average age of death in Erie County has been a 38-year-old for about 5-6 years running. Last year, that went up to about a 42-year-old.
Cheryl Moore is the director of Erie County's opiate task force. She sits here at her desk looking at these numbers several times a day. She says it's not heroin or painkillers killing people.
The biggest thing that is affecting our population here is fentanyl. It's not what you get in a prescription. It is analogs, it is illegal, and people don't know what they're buying.
Niagara County health officials tell me they're seeing the same thing. Last year in Erie County, hundreds thought they were getting cocaine, but fentanyl led to a life-ending overdose.
This is somebody that is expecting a stimulant. They had no idea they were getting an opioid.
Moore says the COVID-19 pandemic continues to worsen the number of overdose deaths, with many turning to drugs to deal with the isolation.
It doesn't have to happen, folks. We can make things better today. We know how to do it.
Both counties' task forces are working to reverse the trend. Erie County has a Text for Narcan program that sends Narcan directly to you in the mail. They also have training sessions teaching you how to use it to save lives. For those using, you can call someone to be with you over the phone so you never have to do it alone. And the program New York Matters can get anyone care quickly.
We will get you an appointment at a long-term care provider of your choice within that 2 weeks.
Moore says this is something everyone should be thinking about to protect members of our community.
It needs to be in our conversation every single day. We want people to be safe and healthy, and we know that no one woke up one day and said, I think I'll be a drug addict.
Now, the next virtual Narcan training is tonight from 6 to 8. If you're looking for a hands-on in-person training, there's one this Saturday morning and next Tuesday evening. And if you or someone you know needs help, Erie County has an addiction hotline. It's 831-7007. These resources and more available for you on our website at WKBW.com.